Nigeria now has close to 10 cases of COVID-19 positive patients, after 5 more persons were confirmed yesterday, including a 6-week-old baby. With this clear case of the generation now prepared is Nigeria for the upsurge. And even on the medium and long terms, a lot of people do not consider the prognosis quite encouraging. We're now going to examine the choices available to the health authorities, the government, and Nigerians by speaking with Dr. Joseph Onigbinde, an infectious diseases expert and Executive Medical Director, Roheka Medical and Dental Hospital, Lagos. Dr. Onigbinde, good morning. Thank you for joining us. Good morning, sir.
Good morning.
Good morning, doctor.
Good morning, madam.
Yes, good. No, this is Tundun, this is Leila, and I'm Ruben Abati. Well, yes, Dr. Onigbinde, well, I mean, Nigeria is facing this very serious challenge just like the rest of the world. And in the last 2 weeks or so, government at various levels has been making all kinds of efforts. Do you think that now that we are in the phase of containment, initially it was prevention Nigeria was focusing on, now we're dealing with containment. In your own assessment, do we have the capacity? Do we have what it takes in terms of personnel, testing kits, respirators, and all of that?
Thank you, Dr. Abati. Pleased to speak with you. Well, I'm afraid that Nigeria is not ready for containment at this time around, because a lot of the even basic equipment that we need to be able to contain or be able to prevent are not actually available. I went out to a public hospital 2 days ago, and I was ashamed of what I was still obtaining. Basic equipment such as hand gloves and sanitizers and face masks are still lacking in many of our institutions. Our institutions are very, very weak, particularly primary health care institutions. We have not built any solid structure at all. And I'm afraid that we may record a lot of mortality, morbidity if this virus should actually come as it is now. It is now with us. Now we're counting about 8 cases, which is very serious. I thought it was going to stop at 1 or 2 cases like we had in the days of Ebola. But now it appears as if it is growing. So we need to do something very, very, very important, very strong by both the government and the individual health practitioners.
Thank you, Doctor. What needs to be done at this point? And can you also give us the medical perspective on the fact that the federal government has, at long last, imposed flight restrictions on 13 countries with more than 1,000 cases, whereas a country like Ghana had previously imposed restrictions on countries with more than 200 cases. Does that matter from a medical perspective? And what about a country like Djibouti that does not have a single case of COVID-19 but banned all international flights?
Well, I think I want to back banning of all international flights. Just banning 13 countries might not be enough for us at this time, I'm afraid, because Ghana, for instance, banned people that had more than 200 cases, and we are talking of 1,000 cases. I think I would support for some time, at least even for a short while, maybe for a month or so, let's ban completely international flights. That may make us a bit safer. And then on the part of Nigerians and entrepreneurs, I think with this time we actually got working, manufacturing basic equipments like hand sanitizers and gloves and face masks. I think it's a thing that they should venture into at this time. We don't have to depend on the outside world, on China and the other places. I think it's a basic things that should be able to be done in our country, so that at times like this, we will not have to depend on people to go and import. As it now, you can't go to China because China is the epicenter. So I think our people should get up now. And I also think that we may have to impose some temporary ban on large congregations and associations. And this may affect some big churches and mosques, because if just a case enters into one of them, it can spread like wildfire. So that is my own opinion. That is what I think. I think Nigeria should go a bit more far-reaching.
Certainly, Doctor. I completely concur. I just wanted to note, I believe that China also recorded no new cases yesterday, I believe, for the first time, or was it the particular Wuhan domestic cases, which is great news for China. But Doctor, I want to look at how this new outbreak or this existing outbreak affects Nigeria and our unique problems as well. Now, the government has told us that we have 8 confirmed cases, and none of those cases are based on community transmission, which means that all of the cases accounted for right now are cases that have been brought into the country. Yet, we're looking at reports of some of those cases. One of the examples I'll give is the American citizen who was positive and in Ibadan, Oyo State, for 2 weeks, not in self-isolation, and one can only wonder how we haven't had reports of community transmission yet. I want you to give your analysis of what you think the reality of coronavirus really is in Nigeria right now and how it affects our unique existing problems. We have a Lassa fever outbreak. I believe 161 people have died in 2020 thus far. We have other outbreaks that are existing, malaria, TB, HIV. How does it compound with our existing problems? And what is your take on the reality of the situation?
Well, I'm afraid it is good to hear that China does not have new cases, and that's cheering news for everybody, including Nigeria. But I want to say that having 8 cases at this time is a bit scary to Nigeria because, like I said, we know we are very mobile people, and with a large congregation, you can go into hundreds and even thousands. So I think we have to be up and doing about. That's the problem with Nigeria. We are very reactive when we have something like this, but we are not proactive. I think our government and individuals should do a lot more about being proactive. Let us not wait for the attack before we start to do a fire brigade approach, which Nigeria is noted for. So as it is now, I think it's a very serious situation. And what was your last question, please?
I was asking you how you think this relates to our unique problems, existing healthcare issues and crises that we're facing at the moment, Lassa fever outbreak, existing malaria, tuberculosis cases, HIV.
Well, it's a pity. It is bad. It will affect our productivity, even as economic activities will also be paralyzed as we are going now. We have problems with HIV, we have problems with Lassa fever and some other things. And then we now come to have a problem with coronavirus. I think it's a bit debilitating, and it's going to affect us seriously. And I think we have to pray and walk and pray. Nigeria always depends on being prayerful that God will prevent this from coming to us. Faith without work is dead. So I think everybody should be up and doing right now because it's very serious to have very major infectious diseases affecting Nigeria.
Well, Dr. Onigbinde, there is a lot of information out there about the nature of this new strain of coronavirus.
I say it will impact very, very adversely on our economic activities.
Yes, we heard you. You know, I was saying that there's a lot of information out there about this new strain of coronavirus. But we'd like you to assist us with further clarification. Some people say, for example, that all you need to get coronavirus is to be in the same room with anybody who has it, either somebody who is having mild or severe symptoms or somebody who is even asymptomatic. What are the predisposing conditions? Is it by touching surfaces, or is it when somebody coughs around you or somebody sneezes? What exactly is it that makes this virus so notorious?
Yes, you've got all the situations that you've mentioned are actually circumstances that can predispose to having coronavirus infection. This is highly contagious, and we know for now that it is spread mainly by droplets, not through aerosols. But if you have somebody very close to you, like you just mentioned, people in crowded environments, like we have in our IDP centers and even other places, that will predispose you to having it. And of course, if you also have, if somebody sneezes near you and the droplets falls on the hand, and you perhaps did not know, and you touch its surface, the virus is still able to survive for some hours, and anybody just coming in to touch that surface will also get infected. It is very, very infectious, and we must be very careful. And as it is now, not everything has actually come out of that virus. It is an RNA virus, very, very, but one good thing is that it is susceptible to environmental changes because it's an envelope virus. So if it stays near a very hot environment, it might not last very long. But as soon as it gets into the nasal or the epithelial surface of the body, it begins to multiply. So it is a very, very infectious, very contagious virus that we all must be careful when you are near somebody who is coughing or who is sneezing, and the person is advised to always sneeze into the elbow, not just into the open air, because it is dangerous.
Well, thank you, Doctor. Can we talk about the advice about hand hygiene in a country where 46 to 47 million people practice open defecation? Nigeria is the world's capital for that practice. How feasible is this advice of washing your hands using hand sanitizing gel? But sorry, we're going to take a short break now, and we'll take your answer right after. Please stay with us. Welcome back to the morning show here on Arise News. We're still with Dr. Joseph Onigbinde, an infectious diseases expert and executive medical director, Roheka Medical and Dental Hospital, Lagos. Sorry for that intermission, sir, but before the break, I was asking you about the practical limitations of the hand hygiene advice that the WHO has given, considering the fact that Nigeria is the capital of open defecation, with 46 to 47 million Nigerians in this practice, unable to access water.
Nigeria is a nation with people who have open defecation, and we must also agree that we are a very poor nation, though we are rich, but poverty in the midst of plenty, like diabetic state. But nevertheless, like I hinted, it is very, very necessary. The virus itself is very sensitive to environments. So, and that's why you have to wash our hands and also use hand sanitizers. And it is a culture that you should have cultivated by now. But unfortunately, it is still not with us yet. So I think the government and individuals too, and non-governmental organizations need to do a little more on community cultivation to see that the importance of hand sanitizers and washing of hands and everywhere we go is very, very important. And then I also mentioned that we could also have the people who could produce hand sanitizers. So if you have hundreds of companies that can manufacture hand sanitizers and basic equipment like face masks, I think the prices will come down, should be affordable to almost everybody. So that is what I will advise, that people should go. I don't think it is too capital intensive now to go into manufacturing of hand sanitizer. A friend just told me yesterday that he has a company doing that. I said, oh, that is kudos, that is great. That means our people can actually start to invest in such things. I think that is my own recommendation, that you have more people, more of these entrepreneurs going into manufacturing of hand sanitizers and basic equipment, so that the prices can go down and become affordable, because infectious control depends seriously on washing of hands and use of masks and so on. So I think that is my advice, that people should get up instead of investing on other things that will yield you maybe a lot of money, but this is something that will benefit both the populace and individuals.
Well, the Central Bank of Nigeria did just announce a 1.1 trillion naira intervention fund. Oh, sorry, Doctor, do go on. Oh, sorry, I thought you were still speaking, Doctor. The Central Bank of Nigeria did actually just announce a 1.1 trillion naira intervention fund, with 1 trillion naira from that, I believe, going towards the manufacturing sector. So it would be good to see innovation in hand sanitizers, etc. But I sort of want to follow on from Tundun's question to you with regards to the reality of practices in Nigeria today. It's only in October that we overtook India as the #1 country for open defecation in the world, with just under 50 million people in this practice. The reality is people are not washing their hands. The reality is sanitation and hygiene is a huge problem. So what I want, Doctor, is I want us to give a realistic framework to this situation in Nigeria right now. The government has told us we have 8 confirmed cases. Given our population, what would you say is...
everybody to wash hands?
No. The government have said that we have 8 confirmed cases. Given our population and given the reality of practices, poor hygiene standards across the country, what would you say is the realistic number of cases that we probably have in the country right now? Is it in the hundreds? Is it in the thousands?
Well, I said it earlier on that if care is not taken as state now, Nigeria is not prepared. Both the government and the populace were not prepared to face this coronavirus. Our only hope is not only in God, also in our individual being careful. If care is not taken, we'll be thinking of thousands, because Nigeria is very, very, very populous, and like we mentioned rightly, that hygiene is not in our culture. For the future, I think we have to tell our people the importance of sanitation. But for now, we can only say, may God help us. And it is rather almost too late now for government to start to set up institutions or structures for people to go and be washing their hands. Ideally, they should have, a study was actually done to show that some private hospitals, some private centers actually had hand washing techniques, and it actually improved the knowledge of people, and people in that area are actually doing what is right. I think it is time the government took a bold step to set up such structures in all the localities as much as possible. But as it is now, we just continue to pray, and our contact tracing must be very good, because we had 8 cases. You can be sure that you have about hundreds of people that are very in contact with all these cases. So if you have hundreds infecting another 100, before you know it, in a couple of weeks, we'll be talking of thousands, which I pray should not be our situation.
Well,
the situation right now on the ground is very, very sad. Yes, sir.
Dr. Onigbinde, well, I'm interested in your reference to prayer, and also the fact that you said earlier on that coronavirus is an envelope virus, and that it may not survive in under certain conditions. But let me ask you, in terms of treatment, one Islamic cleric, in fact, the chief imam of Ghana, has advised Muslims during this period to take alcohol, because according to him, the consumption of alcohol can help prevent coronavirus infection, and that's reported, in the media. At the same time, WHO has said something about ibuprofen, and some people have also made statements about the use of paracetamol, aspirin, and another drug called ribaflavir, which is from Japan. What will you advise people to do? And is it true that alcohol can help?
Some people have proposed so many things. Some talked of paracetamol, some talked about ibuprofen, even WHO has said that, and some said chloroquine. It is possible that these substances actually eliminate coronavirus. But as for alcohol, I don't know about that. And I've also had some funny cases that, you should be having sex regularly, that having sex regularly will prevent the coronavirus. That looks to me as very funny and laughable. But as for alcohol that the imam said, maybe he just wants to drink alcohol, because I don't know how you can drink alcohol and put it inside your nose, because we know that this virus, most of the time, they have a respiratory tract where they have their receptors. So I don't know about the alcohol. As for paracetamol, cases that have been managed were said to be successful with paracetamol, with chloroquine, with ibuprofen. So I think we still continue to see that more facts will still come out with time. But as for the alcohol, that I don't know. We know that if the virus gets into the stomach, because of the acidity of the stomach, the virus will be destroyed. I know about, but what if the virus does not get to the stomach? If it goes into the respiratory tract where it has a lot of receptors, both the upper and the lower respiratory tract, that's the problem. That is where we say we have to avoid touching our noses, touching our ears, touching our mouth.
Thank you very much.
As we talk,
Dr.
and as we shake hands.
Thank you very much.
Thank you,
Thank you very much, Dr. Onigbinde.